Dr. Krishnan, many people use oxygen therapy for a condition called chronic obstructive pulmonary disease or COPD, but they may not necessarily be familiar with some of the details of the condition. So, can you give us a brief overview of COPD?
Absolutely. So chronic obstructive pulmonary disease, so each of the first letter of each of those words, when combined, becomes COPD. So if someone says COPD, they're talking about chronic obstructive pulmonary disease. Chronic obstructive pulmonary disease is a chronic lung disease that develops in individuals, for the most part, because they've breathed in um, polluted air or smoke or chemicals or fumes that have damaged their lungs. Typically, chronic obstructive pulmonary disease develops over years. So it doesn't really come from smoking one cigarette or breathing in noxious fumes for a day or a week. This is really repeated injury to your lung over many years of breathing in really poor quality air. Chronic obstructive pulmonary disease affects probably somewhere on the order of 20 to 25 million people in the United States. Most people with chronic obstructive pulmonary disease haven't been diagnosed. And so we're spending a lot of time now on ensuring that people get the test they need at the doctor's office in order to get their diagnosis, and really work with your doctor, nurse, respiratory therapist to develop a care plan that's appropriate for you. In most cases, people with chronic obstructive pulmonary disease can lead relatively normal lives. And in most cases, people can lead their lives in a way that makes them happy and allows them to enjoy all of the things they need to. What I tell my patients, after a diagnosis of chronic obstructive pulmonary disease, is I work with them to create an individualized plan in order to make sure that whatever they're being exposed to that created the disease, we can find ways to have them breathe clean air. So, for example, if you're smoking cigarettes, we spend a lot of time on options to stop smoking, have them meet with a smoking cessation counselor. There are many medications that are now available. There are behavioral techniques to stopping smoking. If you're working in a factory or in another setting where you're breathing in noxious fumes, how do we get you reassigned to a job where you're no longer exposed on a day-to-day basis with air quality in such a way that that air quality is affecting your lungs? In a very small percentage of people, we think around maybe 3%, maybe 5%, but somewhere in that ballpark, the reason you have chronic obstructive pulmonary disease is you have a genetic abnormality that really makes your lung unable to handle even the air that it's breathing, even if it's clean air. And in those individuals, they might need other kinds of therapies, if you will. And one of the most common causes of genetic disorders that gives chronic obstructive pulmonary disease is something called alpha-1 antitrypsin deficiencies. And there are treatments available for that as well. So chronic obstructive pulmonary disease is a relatively common chronic lung disease in the US and in the world. It's most often caused by breathing in poor quality air, and that could come from outdoor air pollution or it can come from cigarette smoking. In some small percentage of patients, it's because of genetic abnormality that creates the lung disease, if you will. I want folks to know that for the most part, people with chronic obstructive pulmonary disease could go on to live very meaningful lives. And there's a lot we can do now to help you breathe better, live longer, and have a satisfying life.